It did not begin with a system. It began with a crisis no system was prepared for. In 1918, a deadly wave of disease spread rapidly across the world. Known as the Spanish flu, it moved through cities, towns, and entire nations with a speed that overwhelmed existing medical structures. At the time, healthcare was not organized the way it is today. Hospitals existed, but they were limited in number and capacity. Public health systems were underdeveloped. Coordination between regions was weak. Many communities relied on local doctors with few resources, and there was little global understanding of how to respond to a pandemic of that scale. As the disease spread, these limitations became clear. Medical facilities filled beyond capacity. Staff were stretched thin. Supplies ran out. Entire communities struggled to manage the growing number of patients. Information was inconsistent, and responses varied from place to place. The crisis revealed a gap, not just in medicine, but in organization. What followed was not immediate recovery, but a gradual realization that health could not be managed as isolated efforts. It required structure, coordination, and planning at a national and global level. Governments began to recognize the need for centralized health systems. Public health agencies were strengthened. Data collection improved, allowing better tracking of diseases. Communication between regions became more organized, helping responses become faster and more consistent. The people most affected were not only those who fell ill, but entire societies. Families lost members. Economies slowed. Daily life was disrupted. The impact extended far beyond hospitals. This forced a shift in thinking. Health was no longer seen as an individual issue alone. It became a shared responsibility. Over time, this led to the development of systems designed to prevent, monitor, and respond to health threats. Vaccination programs expanded. Sanitation improved. Medical training became more standardized. Infrastructure grew to support larger populations. Decades later, organizations like the World Health Organization would emerge, reflecting the understanding that health challenges cross borders and require coordinated global action. The modern healthcare system with its networks, protocols, and preparedness strategies did not appear suddenly. It was built from the lessons of moments like this. The pandemic did not create healthcare. It revealed the need to organize it. Today, hospitals, emergency response systems, and public health strategies all carry the influence of that period. The way information is shared, the way outbreaks are tracked, and the way communities respond are shaped by what was learned. This story is not just about disease. It is about systems. It shows how pressure exposes weaknesses, and how those weaknesses can lead to transformation. Why do we learn history every day? Because understanding how global crises shape systems helps the present generation strengthen what protects human life, and guides future generations to build healthcare structures that are prepared, coordinated, and resilient in the face of uncertainty. History is not old. History is living inside us. One day, one event, one lesson. Mr. Fidi,